this time Moderna, to get me back up to speed, and particularly as we face into some of the challenges of Omicron as it starts to sweep around the globe. I'd really like to use this just brief opportunity to remind people of the importance of getting your boosters done. If you had your 2nd dose before July of this year, now is the time to get your booster done. There's capacity here available today. We have at least 20 clinics across the state clinics that are able to do your Pfizer or Moderna booster doses. There is capacity tomorrow, and there are booking slots available over the coming weeks. And really, it's now something I'm afraid we all have to put on our Christmas to-do list, is to go and get our booster doses done. So far in the state, we've done over 350,000 Victorians who have now had their 3rd booster dose, and my thanks to them, and congratulations to them to getting themselves well sorted out before the holiday season. But there are still a number of, around 400,000 Victorians that are still eligible to get their booster. We'd really like to see you coming forward and getting that booking in or getting it done. You can, of course, and you should really go to your general practitioner or pharmacies. They are able to do, and they're geared up to do booster doses now and over the holiday period. And as always in the Commonwealth's programme, the GPs and primary care have been at the very forefront of the vaccination programme. And can I thank our colleagues across primary care for the fantastic work they've done on the vaccination programme to date, and also recognise the hard yards they're going to put in over December, January, February and the months ahead as we get on top of our booster programme. But it really is a very important thing now for us all to do, and to make sure we get ready to get that done. That takes us also, not only did what we are seeing is a good response from Victorians. So over 17,000 booster doses done yesterday across the state of Victoria. That's a 4-fold increase in just 2 weeks. So it's great to see people now starting to really surge in and start thinking about boosters and getting it done. And my thanks to them for doing so. On top of that, of course, we've also seen a record numbers of testing. So now over 92,000 PCR tests completed yesterday and run through our state labs. We have thousands of people out there across 260 testing sites across the state, and of course hundreds of people working in our pathology labs all across the state processing those results. I'm delighted because of their hard work and hard efforts. 9 out of 10 results are coming back the next day, giving people early confidence around whether they're negative. But of course we did see 1,503 positive cases yesterday, all of them being followed up through our normal contact tracing processes. We are seeing that very high demand. Waiting times were around an hour, between an hour and a half yesterday on average, but I know there would have been longer waiting times at some sites. I would urge everybody, if you are symptomatic, you must get a PCR test. If you're a close contact, you've been told you're a close contact, whether it's at work or socially or in your household, you must get a PCR test. If you're just a bit concerned, and if you're not quite sure and you're not quite sure what it's all about, then please think about getting a rapid antigen test at a pharmacy or at a supermarket. They're easily and readily available, and we'd encourage increasingly people to start thinking about using rapid antigen tests as part of their staying safe arrangements to check in on your own health and how you're going. But also as you start to think about some of those high-risk activities that we might be doing over the coming days. If you're going to go and visit relatives in aged care, if you've got a large indoor Christmas party and you're not quite sure about your own state going in, then please think about using a rapid antigen test to keep yourself safe, but also to keep people around you safe. Most of all, and most important of all, as we go into the holiday season, if you've got any symptoms, the only thing you should do is get a test. Don't do anything else. Don't go to the Christmas party thinking, well, I'm just a little bit off colour and I should be okay. We just cannot afford the risk of wider onward spread over these critical few weeks, as we all just want to be with our loved ones, but we don't want to be spreading the virus around any further. Finally, with regard to Omicron, we now have just over 60 confirmed cases of Omicron here in Victoria. All those individual cases have come either out of international arrivals or their close contacts, or out of the recent Newcastle cluster and their immediate contacts. All those contacts are isolating, and my thanks to them for doing the right thing. But we expect there to be more cases than the 60 or so that we've identified and confirmed so far. We're obviously concerned about the cases that we're seeing continue to rise amongst our friends and colleagues and neighbours in New South Wales, and given the high level of movement between our two states, we would expect to see Omicron cases continuing to spread here, which means it's all down to all of us to keep on top of those basic COVID safe measures. Please, if you're indoors, wear a mask. If you're going to gather with people, fantastic, it's a great time of year to do it. If you can do it outside, please do it outside. If you're going to be indoors, open your windows and let's make the use of the good weather that we're enjoying at this point in time. With that, I'll take any questions you may have.
If National Cabinet makes a change to the booster interval,
Yep.
have you run the numbers on how
Yep.
many Victorians could become eligible overnight? Yeah, that's right. So if ATAGI provides advice and if National Cabinet confirms that the booster dose goes down to 4 months, so currently we're on a 5-month interval, if it goes down to 4 months, then immediately there'll be an additional 1 million Victorians who will become eligible for their booster dose. That is why we're back to gearing up our state system to providing booster doses. So we are now literally pulling in hundreds of our vaccine immunisers who were so busy in September and October to join their colleagues here who are already providing those booster doses. We'll be setting up some additional sites again, focusing particularly on some of those key locations across the state to make vaccine boosters available. But of course, we're also urging our colleagues in primary care, GPs and pharmacists to also do their bit to make sure that their patients can come forward and get their boosters done.
How are you making sure that you've got enough of a workforce to actually continue ramping up these sort of facilities, because we know they were slated to all be closing in the next couple of weeks, if not already by now?
Yeah, that's right. Look, and the design of the Commonwealth's vaccination program, in particular on the booster program, was to be led by primary care, and of course we continue to work very closely with them. We have of course recognising now the likelihood that we'll see a reduction in that interval period and the risk we see around Omicron. We're determined to do our bit, so we are scaling up both the physical footprint of the vaccination system, but also drawing in those necessary vaccine immunisers. We had at least 1,200 vaccine immunisers working in the state system at the very peak of our program back in September and October. Right now, all those conversations are happening about bringing some of those people back into our state clinics, and of course, we're having really good conversations with colleagues in primary care to get a sense of their volume and their plans. So I would urge anybody, if you're eligible now on the 5-month interval, check out your GP or your local pharmacy or your state clinic. It really doesn't matter. The important thing is to get your booster done.
One of the government strategies to increase, I guess, hospital capacity and to increase this healthcare workforce was to bring back some of these vaccinators and some of these nurse immunisers.
Yeah.
Given Omicron is spreading, we're likely to see increasing hospitalisation. What will that mean for primary care workers in the hospitals?
Yeah, look, it's an incredibly busy time for the entire healthcare sector. And look, can I just say a few words around literally the tens of thousands of healthcare workers we've got working across our healthcare system. They've been providing that basic care within our health services, but they've also been vaccinating, they've been testing, and our teams have been running so incredibly hard for the last 22, 23 months. And here we are again as we run into Christmas, gearing up again for a number of significant surges. So we are concerned about the risk of increased hospitalisations with Omicron starting to really make its way into Australia. We're of course concerned about the ongoing pressures around providing care within our healthcare system, and as a result we know that our teams are going to be working incredibly hard over the holiday period right into January and February when frankly we'd all rather be doing something else. But that's the role we have to do. We're therefore looking at also drawing in alternative workforces where we can, and we're getting a fantastic response from all those allied health professionals and other places we go to provide additional workforces both into the vaccination system and into the wider healthcare system.
Is this a major headache though at this time of year, given people will be taking leave, particularly as you say after the last couple of years? Do we actually have the humans out there to make this happen?
Yeah, look, we are facing a significant challenge, of course, in the healthcare sector, where many of our staff rightly deserve and absolutely need a break at this time of year and to be with their families and loved ones, just like everybody else who's watching this. But we'll continue to draw upon our healthcare teams. We will ensure that we provide the appropriate staffing to balance those critical needs of providing healthcare within our hospital and healthcare system and providing and sustaining our vaccination program. So right now we're gearing up for a significant drive on vaccine booster doses, particularly from the 4th of January. So let's use the Christmas week to plan in our boosters. We're encouraging our GPs and pharmacists to do the same. There is plenty of vaccine available to deliver that program. We really want to hit the new year very hard indeed and get as many of those booster doses done right at the beginning of January.
And just about 270 testing, how many actual vaccine hubs will we still have open beyond 2021?
Sure. So right now we have 19 vaccination hubs that are operating right now. They're providing both booked appointments in the state system as well as walk-up services. So you can come right here to Sandown, you can go to the Royal Exhibition Building or any of the other 17 state clinics and get your vaccination booster dose done today or done tomorrow. The online booking system is also open, so you can book in your booster dose with confidence. We will be announcing over the coming days additional sites that will mobilise in the early part of January.
And will you be doing pop-up vaccination hubs as well?
Yeah, that's right. Like as we did with the really successful program in for the first and second doses, we will be identifying key locations to run those pop-up booster vaccination hubs, particularly those locations where there's maybe fewer primary care services and facilities available. We're working through those locations at the moment, working again with all of our local stakeholders and local communities to make sure that we can get the booster doses right where it's needed to be.
And just on testing, sorry, there are 14 locations that have already been closed.
Sure.
At one point, almost a quarter of the testing capacity was at capacity. I guess what's causing that? Is it mainly because of people, asymptomatic people getting tested to go on to stay?
Yeah, look, it's an exceptionally busy time for our testing network. Again, we're punching out new records just about every other day at the moment with 92,000 tests returned yesterday. I would say we would urge everybody, as we always do, please check before you go to a testing site. We should expect now, I'm afraid, slightly longer waiting times, at least between an hour and a half on average, and there will be variations around that. So do please check. Right now, when I checked about half an hour ago, the showgrounds had a much shorter waiting time than some of the other CBD sites, and there are always other options available. We are seeing significant demand from Interstate Travelers, with over a quarter of all the tests we're processing for interstate travel purposes. That is part of the pressure that we have to deal with. That is also why we geared up our testing system over the last couple of months. We've added a 55% more capacity to our testing system since October. We'll continue to do that, and those testing teams will be there on Christmas Eve. They'll be there on Christmas Day. They'll be there all the way through the holiday period.
Every single site is open Christmas Eve?
Not every single site, but we will continue to have a really strong PCR testing regime in place all the way over the holiday period. Look, and again, this is a real reflection of the men and women who run our testing and vaccination centres. They will be there when the rest of us will be relaxing and enjoying our holidays. And I would ask anybody who's sitting in line at the moment, or anyone's getting a bit frustrated, please bear that in mind. Our teams have been doing this for, in many cases, 22, 23 months. They've been there rain, shine and hot weather, and they will be there over the Christmas and holiday period.
And just on testing to go interstate, have you made any suggestions to the Health Minister that maybe carried into National Cabinet about dropping those interstate testing rules so that we can ease some of the pressure on our systems?
Oh, look, I think other states have made similar comments. We've highlighted the fact that look, I think we recognise obviously the principles that are there for other states to put those protections in place. It is not a highly productive way to use a PCR testing system, and of course it puts additional pressure on. So the additional queues and waiting times that we're seeing there at the moment are a byproduct of that, and we hope to move to a more sensible arrangement in the very near future.
And as Omicron moves across the state, how do you feel about masks coming back on? Would you like to see them at those big events like the cricket?
Not the Chief Health Officer. It's not my advice to give.
Are you being asked to plan for any additional measures though around Boxing Day test or Australian Open in terms of having to, rapid testing people as they're going in or anything along those lines?
No, look, I mean, look, we're obviously looking great. We're doing a lot of planning and modelling around what might happen and eventuate with Omicron. There's a lot of obviously international experience that we're starting to continue to review day after day, and obviously what's happening amongst our colleagues in New South Wales. Look, we're really focused on making sure we continue to strengthen and reinforce our testing system so people can be confidently tested. We are keen to see people, adapting rapid antigen testing as part of their normal stay safe behaviours. That's why we make rapid antigen tests available within the state testing system, particularly for those who are close contacts in a school exposure setting. So we expect to see continued use of rapid antigen testing for some of those kind of use cases. And of course that's why we're gearing up the vaccine booster program. We're putting real urgency and focus on that, and pulling people back from their holidays and asking people to work those additional hours so that we can get as many Victorians boosted as swiftly as possible before the worst of the Omicron wave hits the eastern seaboard.
And children are going to become eligible in early January.
Yep.
Will the system be able to cope with children coming through, and if there's that interval change on top of it?
Yeah, so we've got we're really excited about the vaccination program for 5 to 11-year-olds. That officially opens on the 10th of January. Bookings will be open beforehand, and there'll be announcements about that in the coming days. Look, and we're already setting up our vaccination clinics. One of the 5 to 11 clinics will be here at Sandown Racecourse, and there'll be others around the state. And it's a really important thing. It's been so important for parents of younger children to know that there'll be a paediatric version of Pfizer, so they can have their children safely vaccinated, and we're really enthusiastic to be playing our part of that. And it will be part of the work program for January, with that first dose due from the 10th of January, and then that second dose due 8 weeks later in March.
Have you been speaking to your interstate counterparts about the need to, drop asymptomatic testing for travel, given a quarter of tests being processed? There are a lot more people who are close contacts, who are moving out and about, and having symptoms, just because of the pressure that does add on our testing capacity.
Yeah, look, I think there's been plenty of commentary. There are conversations, I'm sure, taking place at AHPPC, and I'll leave those conversations there.
You said earlier that it's not an effective use of a PCR system. Do you think a rapid test should be enough to get somebody to stay?
Look, I think we've always seen really good coordination and cooperation between the states through this entire pandemic, and yeah, I'm not going to go further into those kind of commentaries now. I think we're seeing, particularly in New South Wales and Victoria, where we've got both significant caseloads of positive cases. My focus is on running and supporting a public health response, dealing with active cases in our community and finding ways by which we can retain the freedoms that we have and the free circulation of movement that we've got at the moment, and looking after people who need that supporting care because they're positive cases. Getting distracted with other pressures on a testing system is not a particularly productive use of our time.
And is there anything more that you can do to increase testing capacity? I know the open testing centres
Sure.
as you go along as well, but anything more you can do in the immediate term?
Yeah, look, that's why we've increased testing capacity by over 50%, just in the last couple of months. And you go back to the height of our third wave back in September, October, we were punching out around 60,000, 70,000 tests a day. We're now at the 80,000 and getting on to 90,000 tests a day. So we continue to see more tests being delivered across Victoria. There will come a point where, frankly, it's just not productive to put more PCR testing capacity into the state, because we also recognise that if you're getting a PCR test, you're isolating for 24 hours until you get your test result. It has a significant impact on all those 92,000 people who are getting those test results. So we are really keen to start getting people to think about using rapid antigen tests proactively. So use it as something you're going to use to say, well, if I'm going to go to a wedding, if I'm going to go to a club, if I'm positive, I'm putting other people at risk. If I've got symptoms, I should absolutely get a PCR test. But if I want to make sure that I'm protecting my friends and the people I'll meet, then taking a rapid antigen test is a really good way to go.
Are you looking at giving them out for free?
Well, we already, I think Victoria's pretty much unique as being the only state where we currently provide rapid antigen tests free already within the context of our school exposures program. So all of our testing sites will provide rapid antigen tests for people who've had school-based exposures. Why? So we can keep those schools moving during term 4. And we'll continue to explore how we can position rapid antigen tests to give people confidence that they can still go out and about and do the things that they need to do.
Overseas, it's basically you just send in a request, or you can pick them up from the pub. They're handed out pretty freely.
Yeah.
Do you think that will become the case here?
Oh, look, I mean, there are 200 variations of approaches around the world at the moment around rapid antigen tests and just about every other part of policy. So there are lots of examples about how rapid antigen tests are used in different settings. I think we have it for the current phase we're in the Delta wave we've been dealing with and the kind of exposure we've been dealing with. I think Victoria's actually been in a really stable place for the last couple of months, and I think we've adapted to managing Delta in our environment, to being highly vaccinated. We're now focusing on the next horizon. The next horizon for all of us is we all need to get those booster doses done. That is a really important thing to protect yourself going into 2022, and you can't delay beyond that minimum dose interval. Please go and get that done. That's a new thing we all have to get our heads around. It's a new thing we all need to go and do. And we maintain those good behaviours around mask wearing where that's appropriate, around testing when we've got symptoms, and around looking out and protecting ourselves. And rat testing is just part of that.
What percentage of tests are returned within 24 hours?
So over 9 out of tests produced yesterday are returned by the next day. I need to come back to you on the 24-hour number.
And even if we increase testing capacity, we might not be able to easily scale up pathology labs to actually process those PCR tests. At what point is it going to be difficult for labs to process results within 24 hours?
Well, look, I think that's the key to the question, Sumaya, in terms of the value of the PCR testing system is to make sure that people who are symptomatic or who are defined close contacts can get a rapid answer, because we know that if people have to wait 3 or 4 days for their test results, which you don't have to do in Victoria, but if you did have to wait that long, then people won't stay in isolation and quarantine for that long, and therefore the whole value of the PCR testing system gets lost. So speed of response is absolutely critical. That's why we're really comfortable running a testing system at 80 to 90,000 capacity. We could probably eke out a few more thousand if we need to, but I also recognise that for the Victorian community, we all want to keep moving and getting on with our lives, because all those 90,000 tests means there's people isolating for 24 hours at least or 24 hours to get their test result, and there comes a point where where people won't stay in isolation for that long period of time. So
in terms of our capacity, our threshold, we're getting pretty close to it then by the sound of that.
no, look, I think there's
there's a point where, and we see this in the behaviour of our testing stations, the reason we suspend new people coming into testing stations is we don't want people sitting in queues for 4 or 5 hours where we could possibly avoid that. So we would much rather move people to other testing stations or encourage them to come back later on the same day. So just jamming up the system with people who particularly if they're asymptomatic, particularly if they haven't been to close contacts, and if they're just needing tests for some other kind of bureaucratic reason, that's the kind of stuff that I think we'd like to reduce so we can focus on recognising we've got 1,500 cases in the state today. That's a high number. You know, the Omicron clouds are gathering over the horizon, and we'll have to think about how we respond if we're going to see the increase in cases that our friends in New South Wales are seeing. You know, we have plans in place as to how we need to manage that going forward.
Do you have a guaranteed supply of vaccines should that interval change? Is the federal government
Sure.
guarantee that?
Sure. Look, the federal government has been confident around vaccine provision and delivery, and we're confident there's sufficient supply of vaccine to hit both a 5-month interval we're at the moment, to hit a 4-month interval, and obviously we're in daily conversations with the Commonwealth around that.
A Sydney man spoke to media, I think it might have been either today or yesterday. He was symptomatic. He's since tested positive to COVID,
Yeah.
but he was essentially turned back from the testing centre for about 3 to 4 days.
Mm.
I'm sure there are similar things happening, across both New South Wales and Victoria. Do we have a triaging system at our testing centres where if you are symptomatic, you're sent to the front of the queue, or if you're a close contact, you're sent to the front of the queue?
No, look, not at this point. So look, and the sheer logistics of our testing centres are such that it's very hard to move people in and out of lines. There are some options we're exploring, going forward. Should we get into a position where with Omicron we see significant rises in caseloads around how we'd manage that, and if we need to get to that point, then we'll make those announcements.
And how do you think we'll be able to manage those? Does it
If we get to that point, we'll make those announcements, mate.
Can you just give us an idea of the threshold that the system has? What's full capacity in terms of the daily number of tests and how close we're getting to it?
Oh, look, I think the numbers we're seeing now is it's a capacity is not there's no absolute ceiling or cap in terms of the capacity we've got. We've got plenty of supply of equipment. We've got 260 sites. We've got thousands of staff who are working their hearts out, keeping that system moving and working it through. And we've seen that increase in capacity of well over 50% over the last couple of months, and we'll keep finding ways to eke out more capacity out of the system that we've got. I think all I'm signalling is that there comes a point where putting ever more requirements on people to get PCR tests and putting ever more low value requirements for PCR testing into the system is not particularly aligned to particularly a threat of significant increase in cases, and that's why our friends in New South Wales are under significant pressure. That's why we're under pressure, and we'll make the changes we need to over the days and weeks ahead if that becomes necessary.
Here's $1 million question. What's the way to avoid one of those waits? Is there a trick to the system that
Sure.
people can go to different places, or?
There is an awesome secret trick to the system, which is check the website for the waiting times. That will actually tell you what the waiting times are at the vast majority of our sites. Our teams on the sites will give you whatever information you need to make a judgment about how long am I going to be in this queue for, how's this queue going to move, and we do actively move people around the system to say, look, you're going to have a 10-minute drive over here, but you'll face a much shorter waiting time. Those are all the kind of behaviours that we're just going to have to get used to. We've been used to that for many months now. We're just going to have to keep making sure we're prepared for that. So right now, our average waiting times are about an hour and a half. I would always bring a water bottle. I'd always bring a book, bring some things to do. It's not a particularly fun way to spend your time, which is why if you're not symptomatic, if you're not a contact, go to the pharmacy, get a rapid antigen test and use that instead.
It's a big increase from, I think 2 days ago you told me it was 40 minutes was the average wait, so we've had a big jump though.
Yeah, look, in the last 24 hours has been a big jump because we're at 92,000, so it's not a linear curve. When you start to get increased demand on a very busy system, those waiting times do start to stretch out. So I think yesterday the actual average waiting time was 71 minutes, I've been told. We'll see how that plays out during the course of today. This morning it's been pretty busy, but Showgrounds continues to have much shorter waiting times than the other sites.
Omicron is not the dominant strain in some countries around the world.
Yeah.
One, how many Omicron cases do we have in Victoria?
Yep.
And do we have plans to genome sequence every COVID case in
Yeah.
Victoria?
So we currently have 61 confirmed cases of Omicron here in Victoria. So we screen all of our, we have been screening over the last few weeks all of the positive cases that we get every day for S gene target failure, which is one of the potential signifiers of an Omicron case. Those S gene target failures are then run through sequencing to confirm whether it's an Omicron case, and a subset of those cases are confirmed to be Omicron. We won't keep doing that indefinitely because we now know with Omicron well established within New South Wales, and phenomenal work by the New South Wales health team for the way they're responding to that. Now it's landed here and it's started to spread within the community. We will continue to see that spread going through. So we continue to screen a proportion of our positive cases to get a sense of how Omicron is moving through the community. 61 cases confirmed. There are other cases that are further being investigated, but we should all expect to see Omicron moving through as it is moving in other parts of the world.
And I know it's still early days, but do you have an update on what are the conditions of the people who do have Omicron? Are they sort of showing mild symptoms? Are they asymptomatic?
Yeah, I don't have the just to hand at the moment. Obviously, we have around 400 Victorians currently in hospital. We've seen a bit of an increase in our hospitalisation numbers over the last couple of weeks, which is obviously something we're looking at with some concern and some interest. We don't have any confirmed cases at this point in time, I believe, in ICU. But obviously, yeah, we'll watch the situation day to day.
Can you explain why the increase in both hospitalisation and ICU, given our current case numbers have been relatively stable?
Yeah, look, obviously I'm not a clinician, but I think in terms of what we are seeing in our hospitalisation numbers, it's been partly a shift in our case profile over the last 2 or 3 weeks with an older age cohort of largely unvaccinated people coming forward in the case numbers. So we've seen a bit of a drop in the younger age groups as schools have started to ramp down, as we're seeing fewer school exposures, greater proportion of those in their 50s and 60s coming forward with a higher degree of medical complications. As we've always seen, it's heavily weighted around age, and of course unvaccinated becomes a really significant part. Over half of our cases every day continue to be amongst the unvaccinated minority. So with fewer than 6% of those over the age of 12 in Victoria unvaccinated, they account for over half of the daily positive cases that we've seen, and that trend's been consistent over the last 4 or 5 weeks. So it'll continue to be a battle, particularly around how we ensure and support those who remain unvaccinated to get vaccinated, because they will continue to be, we think, have the lion's share of exposure and risk to both Delta and Omicron going forward.
You're obviously always looking well down the path in terms of demand, that sort of thing. What did you think when you saw the Doherty modelling yesterday and the numbers that they are predicting?
Yeah, look, it's pretty horrific. I mean, I'm not close to the modelling details, but seeing those kind of numbers played out on an Australian-wide basis and seeing some of the impact of that in other places around the world, it's extremely concerning. This is not something we wish to see land here in that velocity. That's why we're all working very closely, both across Victoria and across, and as I'm sure across other states, to see what we can do to slow down that kind of growth. I would also say it is, of course, very early days, but we should all take this seriously. This is not a trivial Christmas story. This is a very, very significant threat to our state, to our healthcare system. That's why all of us can do at least 2 things. We can all get boosters when we've hit that 5-month mark, and if a target reduces the period to 4 months, then that allows a lot more of us to go and get our boosters done. And we can all just play safe with those COVID-safe behaviours, distancing, stay outside, play outside, have a good time outside, and wear a mask when you're in those indoor environments.
The Target has also recommended if you're due for your 5-month booster dose around the Christmas New Year period,
Yep.
that you can get it a few days early or
That's
a few
right.
weeks early. I don't think that's necessarily being communicated as effectively to people on the ground. It's a federal government responsibility, but is the state working with the feds to sort of get that comms out wider and clearer?
Yeah, we continue to urge our colleagues, in the Commonwealth to make as much noise about the booster program as possible and the importance of getting boosters done. Look, certainly in terms of the state clinics, if you're due to get if your 5-month point is over the Christmas and New Year period, you can come and get your vaccination done before Christmas. So you will not be turned away from any of our state clinics if you're at 4.5 months from your last exposure date. But yeah, let's keep it really simple. If you had your 2nd dose in July, come and get your vaccination booster date now. If you had your vaccination in August or subsequently, then start planning when you can have your vaccine booster done, so you can get it done as quickly as possible.
Sorry, Jeroen. Are you worried Victoria will run into issues if that booster interval is brought down further again next year, especially with the rolling out of the jabs for kids?
Yeah, look, it's a good question. I mean, there is already significant. Yeah, there will be significant pressure on GPs, on pharmacies, and on the state clinics in terms of getting vaccinations done. But if any of these projections that we're seeing around Omicron are accurate, and it is very, very early days, then the one thing we know is that getting boosters done as quickly as possible makes a material difference in terms of the number of people ending up in hospital and the scale of numbers we're likely to see. So we would much rather have the pressure and the urgency of having to vaccinate lots of people. I'm sure the GPs and the pharmacists will feel exactly the same way. We'd rather be really active and really busy in the early part of January and just punching as many people through as we possibly can to avoid the worst of the Omicron pieces. And if to do that, those timescales need to drop, then those timescales will need to drop.
Just on that, but sometimes you How can we fix that for other people?
Oh, look, I mean, I think this is we've done this before. We did it with the vaccine program back in September, October, and November. We were pushing out around 300,000 doses a week out of the state system, over 400,000 doses a week through the GP and pharmacy system. Look, none of us, we'd all rather be somewhere else in Christmas and New Year. I fully appreciate that, but also there will be literally hundreds and thousands of people working in our state clinics to get vaccinations done. There'll be hundreds of thousands of people working in our testing centres to make sure that people who are symptomatic and who need that support can be tested and can get the result really quickly. And there'll be thousands of people working in our hospitals and healthcare systems to keep people safe and well. So that's we don't get to choose when Omicron turns up. The only choice we get is to when we get our boosters done. And I'd urge everybody to please get it booked in as quickly as we can, and we will do everything we can to get your boosters sorted.
Sorry, just finally here.
Sure.
Data shows that only half of all Australians eligible for boosters are getting them. Do you think this is a failure of supply or messaging?
No, I think for all of us, for many of us, it'll feel like we only just finished getting our second dose. So now talking about third doses feels a little bit preemptory, and I think we'd all rather be doing something else. Frankly, I've got a heap of Christmas shopping I should be doing. I've got a lot of things I'd like to be planning for the next couple of weeks, but actually I can't do that. We're going to be thinking about booster doses, and I'm sure many of Australians will feel the same way. So this is a bit of a reminder that says summer's fantastic, and it's great to be in a better place than we were in 3 or 4 months ago, but we've also got to pay attention to preserve this kind of status that says we can keep things open, we can keep going to the shops, we can keep everything moving. Critical to that is getting your boosters done. So I think we all need a bit of a reminder that says just get it organised, get it done. It takes 15 minutes, and then we can move on with a bit more confidence. Okay.
Thanks. This done, there's some current 61 total, not 61 new.
61 total.
Yeah.
Total. Yeah.
The Omicron clouds are rolling on the
Yeah.
horizon.
Yes.
You said? Yeah,
Yes.
I liked it.
don't run that.
That's what I think it's already
Thanks,
cut
all.
under that.
All right, thanks guys. Hopefully I don't have to see you again for the next 3 months.
No, we don't want to see you either.
Thank you.
Yeah.
Yeah, likewise.
Yeah, no New Year's.
Thanks, guys. Have a good one. All right.
Thank you so much, Jeroen. Take a Panadol before you go to bed tonight.